I don't know about you, but as a nurse of 30 years, I certainly came from a background of using lots of pieces of paper, struggling to find a pen that worked, looking for the right file, finding the pieces of paper that I was looking for, and then looking for another folder because part of the information I needed was somewhere else. So we've moved on over that 30 years. And so today I'm going to talk to you about nurse-led co-designed aged care software to improve outcomes. The industry of aged care at the moment consists of 668 approximate facilities across New Zealand, caring for 40,000, nearly 40,000 residents. Now that means also that there are nearly 40,000 staff looking after those residents. So what are the problems that were noted that we were trying to address with the solution we came up with? Certainly COVID over the last 2.5, coming into the third year now, has raised a number of issues and caused us to have mindset shifts on a number of things and how we do things. So on top of COVID, we've also had a progressive and increasing workforce and skills shortage. We've had increasing demands, certainly over those 30 years. Residents in aged care are very different in their presentation now to how they were, and their needs are certainly far more extensive and complex than they were. So there's high levels of regulatory requirements, we need nursing best practice evidence, and of course legislative compliance through audit process, and we need to evidence all those on the basis of continuous improvement. We had fragmentation, as I mentioned, about the paper-based clinical records and also the operational records. You'd go into nurses' stations or managers' offices and there would be files and files and files and desks of files. Very time-consuming and difficult looking for what you're trying to find to make decisions. So the need for remote access to clinical records certainly came to the fore through COVID and in 2020 when we had those first outbreaks of COVID-19, and I had the experience of managing a facility through that outbreak, in which time we were able to use the digital solution that I'm going to talk to you about today with great success, which was very satisfying for all concerned. So the solutions available previously as a digital solution, or the start of the digital solutions that we were seeing to take us from a paper-based system to online, were generally not New Zealand specific or not nurse-led. So our clients, when we started with the paper-based policies and procedures that we were providing, started saying, well, actually we'd like this or we'd like that, and we started studying their audit reports, looking at the gaps that people were falling through. So we started to develop our digital solution for clients, residents, records and clients in aged care services to use. And that started with adverse event and benchmarking, because we didn't have a New Zealand specific benchmarking program at that point in time. So we started with adverse events, and then on clients' requests we added infections, and then we added restraints, and then we uploaded into an online document library the policies and procedures, and bit by bit the system evolved. So what it became very clear was that the solution for the sector needed to be nurse designed, it needed to be nurse led, so that evidence-based nursing was part of the solution and very easily evidenced in the documentation or the records that were being noted into the system. It needed to be co-designed in partnership with our clients, as I say, New Zealand specific, and it needed to be easy to use. One click instead of two, and no harder than Facebook. We had a very simple rule when we started developing the HCSL digital solution, was that if somebody could use a cell phone to send a text or could use Facebook, they needed to be able to have that same level of simplicity and ease of use in the solutions that we were providing. It also needed to be cloud-based and make sure that it was able to interoperate with other modern software packages. So what's behind the design? As I say, 30 years of nursing practice and managing of aged care facilities, so that bedside experience. Lead auditor since 1999, so I also wanted to make sure when we designed the software that we built in the compliance requirements so that it was easily evidenced for audit purposes, that didn't need to be something else in addition that was done. So in effect, being simplistic and putting up one piece of data in and having it go to wherever you needed it. So added considerations, of course, we've now got new standards, the Ngāparewa Health and Disability Services Standard, which is a change of perspective, and the software needed to be able to evolve and show those changes and keep up with the evolution of what was required. So terminology-wise, it needed to also reflect updated policies and procedures as they continue to occur. And it also needed to be able to support the pandemic outbreak preparedness and make sure that information could be easily accessed by allied health, the doctors, the physios, the dietitians, or wound care nurse specialists that might be off-site and not able to actually come on-site. So that was certainly a key factor as well. As I say, we were very determined to make sure that we eliminated the previous history of fragmented paper-based systems. We also had to take into consideration in the ease of use that we wanted consistent interpretation of what was required by way of documentation into the system. So thinking about our international workforce and some with English as a second language, we wanted to make sure that all of those factors were built into the software, and we've worked hard with our IT development team to do that. So it was SaaS-based, so software as a service, so cloud-based and all in one place. That was what clients were asking for. So every time we added a new feature, they'd say, this is great, but wouldn't it be good if actually we had this as well? So we have had a process of Agile Development over the last 3-4 years. In particular, we started this project in 2015, but in earnest since the end of, getting towards the end of 2019. So it was very timely for going live in a remote system with the COVID pending. So we were able to streamline and put everything in one place, so it wasn't just adverse events and your national benchmarking and your recording of infections. It was care planning and progress notes, resident profile and automation, so that the nurses' care plans were automated from one point to the next, so they weren't having to restart and write what they'd already written somewhere else. So automation was an important and very deemed to be a very useful part of the system. So the market share that we have is of those 668, 50% of those predominantly are corporates, and a number of those bigger corporate groups or big multi-site groups have their own software package. So our client base has up until now been more the independents and smaller groups. We have, as I say, 96 facilities and retirement villages that we're working with, which incorporates 5,600 residents and growing. We've got more coming on board at the moment. We also have 2 community care providers and 4 primary health organisations. So at the moment, as I say, with increasing numbers, 4,800 active users of the system. So our client's success is our success. So we have alerts built into the system to help prompt them, but we don't have so many alerts that we get that the users get alert fatigue, and that's really important because we want to make sure they're meaningful, that they don't get to a point where they're starting to ignore those alerts. So minimal training was also needed. People needed to be able to get up and running very quickly without a lot of guidance. So it needed to be very intuitive. And so we have a series of processes that we include. We don't charge extra for training because we believe that that should be just part of a normal process for software. That if you want people to succeed you can't just, in using it and get the best success, you can't just provide it and say, there you go, on to the next one. Literally, we work in partnership with our clients, holding their hands. So sometimes that mindset shift from using paper-based and looking alphabetically and scrolling when we're starting to use digital is something that then evolves to using keyword search engines and things like that. So it has been a process of supporting clients where they are, and each of them having staff at different levels and finding the on-site computer champion or digital champion, or those staff that are really keen to get into it and start using it. And generally those ones that are a little more resistant start to see others succeeding and seeing how easy it is, and then they come on board. So, as I say, the automation helps save time, and when staff can see that their time is being saved and that they're being successful because it's easy for them to do, then they embrace the system, and that's what we've seen in practice. So the shift has given more time with residents, and ultimately that has been very poor, and with the nursing shortage and aged care services that has been pending for a long time, and we're in the middle of crisis mode now. That doesn't seem to be going away, and until the borders open and we can get people back in and get them trained up for the specialisation, which is aged care, then we need to make sure the systems that we're using are very efficient. So all of that was in the background of design, and will continue to be in the background of further feature design. So as a result of people using the system, what they're reporting to us is that they do have more time with residents. They're more confident in their evidence-based practice. They're able to evidence it and see it more efficiently. There's better health outcomes because of all that information being streamlined. Things aren't being missed. And those changes, those little subtle changes that indicate there's a clinical change with a resident that needs intervention, are being noticed more quickly. And once again, as I say, remote access for physicians and allied health. So the doctor in the past needed to come on site. Now they don't always need to come on site for an acute episode. It might be that they get a prompt from the on-site nurse to say that there's information uploaded into that resident file. They can log in remotely. That's a secure login. They can log in remotely, have a look at the information. They can then go into Medimap or OneChart. We have a software integration with Medimap, so that information flows directly, automatically between the two, not with any prompts. It's just totally automated. Medimap puts information directly into the resident progress note, and once again, that creates prompts for staff as well. It also means that the doctor can update the medication order. That notification will appear in the HCSL progress note for that particular resident, or in the handover notes, so that the nurses are alerted. The doctor can write their progress notes, as in their action plan and their treatment plan, directly into the system as well. So the results, we have a plaque on our wall, which we're very proud of now, on behalf of the industry that we serve, for the New Zealand Excellence in IT Awards in 2001. HCSL was the award winner for the overall Excellence in Software Award. And so these are some of the comments that have come from some of our clients. And we have a number of those on our testimonials, further testimonials on our website. And so just going back over an overview, I'm Gillian Robinson. I'm a registered nurse. I remember when my teenage sons had to teach me many years ago how to attach something to an email. So I certainly didn't come from an IT background. This is a process that we have learned and evolved alongside the sector, and that's been a really exciting journey to take along with my colleagues, nursing colleagues and health professional colleagues. So we founded HCSL Healthcare Compliance Solutions in 2003, and after authoring a book around the management for a guide for managers and nurses in aged care, we then went on and evolved from the policies and procedures in the paper-based system to the online digital, and we continue to add extra features and work very much in close contact with our clients. We say to them that when they contract on with us, that to use this system to make sure that they're successful, we become an external member of their team. So we're not just a software vendor, we see that their success is our success, and we want the solution to continue to evolve and be co-designed with those working in aged care services. Thank you for the opportunity to present to you today.